Ladies and gentlemen, dear viewers and listeners to different media in Oman, on behalf of the Supreme Committee, it gives me great pleasure to meet with you today again regarding COVID or Corona pandemic, COVID-19. I was hoping that I will have some good news for you. I was hoping that the mood would have been much better than last press conference, which was just over 2 weeks ago. But unfortunately, things didn't go the way we want them to go. I'm going to start with the numbers. Yesterday, we registered 288 new cases, which took our total number to, unfortunately, 140,588. Also, those who were admitted yesterday to different healthcare facilities in Oman, 29 patients, and the total number now is 192. And I need to remind you that just a month ago, we had only 51 patients in all our healthcare facilities. Those who were admitted directly to the ICU yesterday, to critical care areas, 4 patients. And the total number today in the intensive care is 68. Yesterday it was 75. Again, less than 4 weeks ago, we had only 20 patients in the intensive care units. We had 4 deaths yesterday, and that took the total to 1,562. Those who recovered, and I hope the rest will follow soon, is 131,684. The total number of tests we did in Oman is 1,148,666. And those who received the vaccine so far, 52,858. That's numbers in Oman. Worldwide, the number exceeded 113,097,755 cases, and the number of those who died from COVID-19, 2,508,927. These numbers, I can tell you, are underestimated because there are many countries who unfortunately do not have the facilities to test for this disease or report it. We were very happy between the middle of October and the middle of January. Our numbers were going down gradually. The pressure on our healthcare facilities was getting less, and there was a breathing space for our healthcare staff who've been working non-stop for a full year. But unfortunately, and for so many reasons, and I'm not here to blame X, Y, Z or anybody, the numbers started to go up and it reached an alarming level. We are extremely worried and concerned that within less than 4 weeks, the numbers in the intensive care units more than quadrupled. If we continued at this rate, God forbid, we might end up where we were a few months ago when we reached 220 patients in the intensive care. I hope we'll never head that way. The sad thing that still many people, unfortunately, they don't seem to have got the message that we can prevent the spread of this virus. We can slow, if not stopping it completely, we can slow it with the measures that all of us know, which unfortunately some choose not to adhere to. Some choose not to follow the instructions of the Supreme Committee. Some still believe that they are immune from this virus, and they don't know that they might carry it to those that they love, and they might lose them. Ending up in the intensive care unit is not something anybody would wish on their worst enemies. And that's unfortunately what would happen if we continue to have this gathering, which are against the Supreme Committee regulations. These gatherings, which are unnecessary and illegal now, are unfortunately the focus for spreading this virus everywhere. We tried our level best to obtain vaccines to cover those at higher risk, and I've mentioned how many we vaccinated. We received so far 156,500 doses of vaccines from 2 different companies, AstraZeneca and Pfizer. And unfortunately, initially there was reluctance from those who were eligible to receive the vaccine. There was some reluctancy. I'm glad to say that it's picking up now. And we divided it into stages, and we covered 95% of those we targeted in the first stage. The limiting factor for giving the vaccine to the private sector or intensifying the campaign is unfortunately the limited number of doses that we have, and it's not a problem limited to Oman only. It's an international problem. We were one of the first 30 countries to start vaccination, but the capacity of the producing companies, unfortunately, is not enough to cover the need of everybody. And it's not a secret. There are certain countries, unfortunately, who are looking only to vaccinate their own people. And I have to repeat something I said, and the DG of WHO said before, that none of us is safe from the virus until and unless all of us are safe. Here again, there is not a single country which can live in isolation and protect its own people only if the rest of the world is not vaccinated. And Oman is a member of COVAX, and we are hoping to get some of the doses from our vaccine from this facility. Everybody, or almost everybody, is doing the right thing, and I hope they will continue. And myself and all the members of the Supreme Committee are very grateful for those who are adhering to the healthy practices to slow down or stop the spread of these vaccines. I see so many images of people not wearing masks and gathering. Hand hygiene is very easy and it's available everywhere. There are shops, unfortunately, which are also violating the regulation of the Supreme Committee. And I'm grateful to Royal Oman Police and other agencies who are following the implementation of these decisions taken by the Supreme Committee. And I've had so many people asking me, how could we report and who can we report to if somebody is not wearing a mask, if there is a shop or a restaurant or any facilities that are not adhering to the regulation. Please remember this number. It's 1099. 1099. All of us are responsible. All of us should be working together to combat the effect of this virus. It is not in the interest of any of us to go back to closure, what's partial or complete closure. It's not in the interest of the economy, the social life, the social fabrics. We are heading toward the holy month of Ramadan, and there are so many questions. What is going to be the fate of this holy month and the social gathering? That depends on us individuals, how to behave between now and the 14th of April. We did it before. The numbers did come down. We can do it again. Let us remind each other again what we need to do. All what we need to do is to wear the mask appropriately when it's appropriate and needed. Avoid gathering, and especially in closed places. Continue the hand hygiene. Please stay at home if you have respiratory symptoms. That's fever, sore throat, cough, aches and pains. You should consider yourself having COVID-19 disease until proven otherwise. I'm extremely worried we are heading toward warmer weather. And that's when people aggregate and gather inside closed places with poor ventilation. And that's a very good media for the virus to spread. So please remind yourself and each other that the protection of your families, your loved one, your society is the responsibility of everybody. It's not the responsibility only of His Majesty's government, the Supreme Committee, the healthcare staff, Royal Oman Police. No, every one of us should be healthcare staff. Every one of us should be a police person. Every one of us should be reporting those who are violating, advising them. I hope when I meet with you again, things will be better, but that all depends again on how we behave. We will and we are working very hard to obtain more vaccines, and from different companies as well, so that we can cover as many as possible. And since I've mentioned vaccines again, unfortunately there have been lots of rumors about this vaccines or that. To start with, let me point, I have an expert here, but for the time factor and the vaccines, for time factor, unfortunately, I will just summarizing what he said. Firstly, there's no head-to-head comparison between this vaccine and that. The clinical studies and trials are very good, and these are the ones which lead to a vaccine or any medical product is going to be licensed or not. And any vaccine that's accredited or approved by either WHO or any of the international agencies, we do look at it in Oman, and we do study it, but we need to obtain both the efficacy and safety profile before it's licensed in Oman. Post-marketing is very important, and I'm going to quote what's been published from the United Kingdom, and in particular from Scotland. They vaccinated, and this is probably a week ago, 1 or 2 days more or less, they vaccinated 1.14 million individuals with the 2 vaccines which are available in Scotland, and they are in the UK, and they are the same 2 vaccines we are using in Oman. And what they found, that those who are vaccinated by both vaccines were protected from the severe disease, the need for admission, and reduction in death. And the difference between these 2 vaccines is not as wide as the difference in the clinical trials. The clinical trials are under certain setting. Here, it's real life. The number, of course, for those who are vaccinated by AstraZeneca was over about 94% protection, and Pfizer, 85, 86%. This is not to say that one vaccine is better than the other. This is to tell you that if the vaccine is available, accredited by Oman and the experts in Oman, please, if you are from the group eligible for it, go and take it, regardless of which company it's belonged to, where was it made. I said it, and I assure you again, we will never allow any medical product in Oman to be used unless we are sure of its safety firstly, efficacy secondly. And please do not follow what is in the WhatsApp and other social media, which spread, unfortunately, rumors more than facts. And sometimes they'll tell you, Dr. So-and-so, Dr. Who, Dr. X, Y, Z said this and that. We go by science and evidence-based, and that's what matters. So please, I'm urging you again to look after your health, your family's health, the society's health. In return, you'll be helping our healthcare staff who've been working non-stop for a year. And for them all, the appreciation of His Majesty's government, of the Supreme Committee, and of all of us. Please keep away from gathering. Look after yourself by wearing the mask and your hand hygiene. Thank you.